The common problems that we have really are sleep apnea, which is something that we all know of, with our insomnias, which unfortunately can be from many, many factors, not just issues like we all say we can't sleep well at nighttime. There's a lot of little things that people don't aware of, or bad habits that we have that can kind of contribute to having poor sleep. And of course there are the rare things that we have that we kind of say are REM behavior disorders, where people kind of act out their dreams a little bit, or the stuff that little kids have, like nightmares, and sometimes even us adults even have nightmares. So we deal with the vast range of problems as a whole.
Well, each one of these disorders has a different kind of risk factor or etiology or causes. For example, if you take sleep apnea, there is it is probably by far much more prevalent than narcolepsy, for example. Approximately about 4 to 5% of men across the country, they have possible sleep apnea, or at least snoring to some degree. Women is less, although the incidence of sleep disorder breathing increase in middle-aged women and postmenopausal. That has to do with some hormonal changes, was the most theory behind that. The causes for sleep apnea really nothing specific, but there is increased factor or risk factor can make it much more likely to happen. In particular, weight gain and high blood pressure, and some ethnic group such as African American people versus Asian descent, people, or Hispanic descent. So those things. The other thing is people who have heart disease and diabetes, they definitely have higher risk of having sleep apnea, or vice versa. What that means is the sleep apnea can impact on these disorders, or the other disorder can do the same thing for the sleep apnea. For insomnia is, I think the reason why insomnia has increased tremendously over the last decade or so, just because the society has shifted to a different type of basically living style, lifestyle. Technology invaded basically our life, in every minute in our life. People tend to want to do their work at nighttime, it's like much at the daytime, and they kind of forget about their sleep as a part of their life, like, basically exercise or eating. Nobody forget eating, but people forget to sleep sometimes, so that's not good. So this kind of lifestyle changes, the society changes, drive our sleep routine to be shifted to a totally different time, and allow us to suffer from what we call insomnia, which can be triggered also by other things such as catastrophic events in life, or environmental changes, or shift work changes. So there's a lot of things, a lot of factors. For example, previously, not many people used to work third shift. Now, working third shift almost routine for a lot of people. They live like this for years. What actually make it worse is not the third shift, it's the rotating shift, like people like, for example, on BMW or Michelin in particular here in Greenville, employee from those companies, I see them quite frequently because the rotating shift creates such a disturbance in their circadian rhythm, which has become a big issue for them.